Nursing case management, chronic illness, hypercapnic respiratory failure. Group 2 consists of Jimmy Lee Dino, Tanya Golden, Ryan Hood, Bridget Martinez, and Whitney Martinez. For our patient, we have a 48-year-old unemployed single female with intellectual and developmental delays. She lives with one of her sisters, who along with another sister, help the patient with activities of daily life. Initially, our patient comes in for generalized weakness times 1 week, fever and diarrhea times 2 days, along with flank pain, and an O2 saturation of 70%. For our chronic illness description, we have hypercapnic respiratory failure, which consists of hypoxia and respiratory acidosis, where CO2 levels are greater than 45 millimeters of mercury and pH is less than 7.35 in the absence of a chronic cardiopulmonary illness. Our patient has no history of pulmonary issues. Upon her first arterial blood gas, her pH was 7.19 and her CO2 was 98. The standard treatment is non-invasive positive pressure ventilation, which includes CPAP or BiPAP. If that's insufficient, intubation with mechanical ventilation then is considered. Our patient was treated with BiPAP initially, then because she was unable to decrease her CO2 levels and manage her secretions, she was intubated with mechanical ventilation times 1 day. Then she was extubated, placed on a nasal cannula, with a repeat episode of respiratory failure where her CO2 climbed to 105. And then she was placed on BiPAP with plans for CPAP at home. For our patients, the primary nursing diagnoses are partnership, supporting transitions, education, teaching disease and treatment, and education, coaching caregiving for the family. The key nursing interventions are to assess the patient and sister's readiness to learn about CPAP and their willingness to comply with its use at home in order to prevent future hospitalizations, as well as education on the new diagnosis of obesity hypoventilation syndrome with obstructive sleep apnea. Assessing the impacts the sisters are enduring by caring for the patient will also be key in finding solutions to any current problems, which can assist them in helping give them better care. For our self-care capacity, our patient, regarding her chronic illness and managing her treatment, is very poor, as she needs assistance even with activities of daily living, and she has intellectual and developmental delays, as well as being morbidly obese, with a BMI of 44.39. A feeling of powerlessness due to her chronic diseases may contribute to her inability to perform tasks and to provide care for herself. Self-management, however, enables the use of outside resources which the patient does have access to. Her sisters are able to assist the patient in caring for her physically somewhat, but they cannot significantly contribute financially, and the patient is unemployed. Self-management, by definition, relies on the patient to care for themselves with what resources they have away from medical professionals. Given that, the patient's likelihood of rehospitalization is high due to the inability of self-care, lack of monetary resources, and limited or non-existent respite care.
Priority patient issues for discharge planning. So it was reported by IHMS that the patient's restrictive Medi-Cal is not active and that they're working with one of the sisters to apply for Medi-Cal. Knowing this, it is then important for the patient's Medi-Cal issue to be resolved in order for proper billing and equipment access to be established before discharge. It is also important for the patient to be discharged home with oxygen, a CPAP machine, and a pulse oximeter so the patient's diagnosis can be managed and signs of decreased oxygenation saturation can be detected. Patient and family education on the new diagnosis of obesity, hypoventilation syndrome with an obstructive sleep apnea would also be a priority of discharge planning. This way, the family is aware of what is going on and is involved in the patient's plan of care. Proper education on the CPAP machine should be taught to all caregivers in the event that any one of them may be using the machine. Access to home health RN to ensure proper setup of equipment as well as vital sign check and evaluation for physical occupational therapy would be beneficial not just for the following reasons, but to also provide family support and evaluation of all caregivers. Lastly, setting up follow-up appointments with the primary care physician and pulmonologist will help caregivers as well as assist in continuing the patient's plan of care. So where are we going to discharge the patient? So the patient will be discharged home under the care of her 5 sisters. The patient's sisters have all been acting as her informal caregivers and have been able to provide her in the past with 24-hour care by dividing it up between the 5 of them. So, in conclusion, as long as the patient's family or caregivers, which are her sisters, are properly trained on equipment use, plan of care, and the patient's diagnosis, as well as show no signs of caregiver strain or burden, a home discharge is in the best interest of the patient.
Hello, my name is Ryan Hood, and I am presenting Nurse Case Manager Strategies and Interventions. For the Nurse Case Manager strategy, the patient level and the system level, the priority Nurse Case Manager strategy at the patient level will be self-management of Mrs. H's hypercapnic respiratory failure. Quote, self-management implies that the individual with the chronic condition engages in daily management by making informed decisions regarding health and life choices. Larson and Lubkin, 2016, page 311. The priority Nurse Case Manager strategy at the system level will be health promotion. Quote, health-promoting behaviors strongly influence whether one prematurely succumbs to disease or whether one postpones and possibly avoids major diseases. Larson and Lubkin, 2016, page 369. The patient-level intervention with reference is that the nurse case manager will support self-management by using health coaching and teaching medication self-management. Health coaching is a client-centered approach to care in which the focus is on the issues and barriers to self-management. The nurse's role in supporting client self-management of medications occurs within the context of interprofessional collaboration with the pharmacist, insurers, case managers, and physicians, as well as directly with the client in ongoing assessment, communication, behavioral and psychosocial support, and education. The system-level intervention with reference is that the nurse case manager will support health promotion by educating about and encouraging the adoption of healthy behaviors. Quote, although chronic diseases are among the most common and costly health problems, they are also among the most preventable. Adopting health behaviors such as eating nutritious foods, being physically active, and avoiding tobacco use can prevent or control the devastating effects of these diseases. Again, from Larson and Lubkin, 2016, page 383.
Hi, my name is Jimmy Dino. I'll be going over utilization review and safety and quality. For utilization review, the primary goal sought out by utilization manager for EH's case is to be discharged home using two items: the home use of supplemental oxygen and the request of a CPAP or BiPAP machine for the use of hours of sleep. The medical equipment requested from the insurance is deemed a medical necessity, and the appropriateness of level care of the patient receiving can be continued at home, ensuring a continuation of care of her treatment. In order to prevent readmission to the hospital, both equipment must be present at the house, so that way it can prevent readmission to the hospital, which in turn will cause increased burden on the family and a greater workload for hospital staff, as it may worsen her condition that may eventually, when it comes to multiple patients coming back to the hospital, lead to RN burnout or higher employee turnover. The result in medical approval, the delay causes discharge from the hospital to be delayed by 2 days, requiring extra resources from the hospital that are not necessarily needed for her stay in the hospital, thus taking resources away from other patients who may need these resources. Quality and safety issues. Reinforcement of discharge teaching to the family. Accurate assessment of discharge needs dependent on the knowledge of the disease process and treatment and regimens. Knowing the importance of each intervention will help reinforce the family of why each intervention is done at home. Why do we put her on oxygen while she plays on the BiPAP machine? Why do you need to assist her with a gait belt while getting up, using the bathroom, or transferring her? Another safety issue is the risk for falls related to EH's CO2 retention and weakness. Now, if she's weak, the use of a gait belt may be appropriate to assist her to get up. Also, this may be used to help her with a controlled descent to the floor if she were to lose the strength to stand up. Poor oxygen perfusion is as manifested by, or as evidenced by admission to the hospital as CO2 retention. The requirement to use a CPAP at home during hours of sleep is something that can be ensured that she doesn't retain CO2, that she doesn't have apneic periods or asphyxiation. However, the improper placement of the apparatus that attaches to the CPAP or BiPAP machine can lead to those increased periods of apnea and asphyxiation. Role caregiver strain. Now, her sisters assume care of EH on a daily basis for 24 hours a day, both sisters. Now, this can lead to financial difficulties, as this may lead to gaps in her care where one sister or both sisters may look for secondary jobs to supplement their own financial income, where it will leave EH unsupervised, thus leading to possible bodily injury due to trips or falls. The necessity for a 24-hour caregiver is needed.
Hello, my name is Tonya Golden, and I will be presenting nursing case management effectiveness at patient level and at the system level. The case management process gives a good platform to use in order to do this. They were successful in stage 1 or case selection by identifying psychological indicators of her severe mental delay. Socioeconomic indicators were the fact that she had inadequate health insurance and was dependent on others for activities of daily living. They were successful in the stage 2, the assessment and problem identification stage. They immediately identified that EH did not have the insurance available as their sisters thought, the need for CPAP equipment at home, and the need for home health nursing to assist the sisters with their care at home. They also identified the introduction of a new medication to keep her awake during the day. They were successful in the stage 3, or the development and coordination of the nursing care management plan. They coordinated with the physicians, insurance or integrated health management services, and her sisters in order to successfully get her home with proper equipment and help. Constant communication with insurance or Medi-Cal with updates to the family was clearly a priority. Then they were then able to come up with an alternate solution with the sisters to rent the equipment until it could be covered by the insurance. And in stage 4 implementation, they were able to arrange a home health nurse to be present when the CPAP arrived. And then once everything was in order, the patient was discharged home with her sisters. A follow-up appointment with the pulmonologist was also arranged. An evaluation would be done through a discharge phone call to see if they were successful. Case manager must have adequate knowledge of different levels of care, health insurance coverage, and reimbursement for effectiveness at the system level. The problem was identified in a timely manner. The insurance status was established immediately, applied for, and followed up on. Documentation throughout her hospitalization clearly mapped out her different levels of care. Inpatient status order was present with anticipation of 2 to 3 days or to midnight active treatment anticipated. So her stay was 4 days longer than originally estimated, but the documentation of the reason for this was documented of her high risk for readmission. Interventions were taken to improve her condition before sending her home, such as physical therapy and the medication prescribed for wakefulness and restarting her on her home meds. The length of the stay overall was prolonged due to her inability to secure insurance that would have taken 3 weeks to be approved. It was the right thing to do to avoid readmission, but may have been avoided if an alternate solution was found, such as maybe transferring her to an extended facility while she was waiting for approval. So let me show you our references. So that concludes our presentation of nursing case management of hypercapnic respiratory failure for Group 2 CSUM SM Class Nursing 442. Thank you.